The David Pakman Show at davidpakman.com.
Make sure to get the David Pakman Show on the go on the Stitcher Smart Radio app. If you've got an iPhone or Android phone, download the app, put in promo code DAVID. You'll help to support the show. You'll also be entered to win $100. And you'll get the show added to your favorite shows list, which is really key. I think the main show, if people are using the Stitcher app, is this show, is it not?
I don't know about that, David. There might be shows that people like more than yours.
The U.S. newborn death rate has dropped to now be tied with Qatar. Babies in the United States have a higher risk of dying during their first month of life than do babies born in 40 other countries, according to a new report. Some of the countries that actually outrank the United States in terms of newborn death risk, in other words, they are safer for babies in the first month, are South Korea, Cuba, Malaysia, Lithuania, Poland, Israel, according to the study. And the U.S. dropped from number 28 to number 41. Again, like I said, now tied with Qatar, as well as Croatia and the United Arab Emirates. And one of the bigger challenges in the U.S. is the number of premature or preterm births. And the U.S. rate of premature births is double that of countries in Europe and Northern Africa. And babies who are born preterm, as you know, need extra care. It's often very expensive. There are a few things that can reduce early births. It is important to note that disadvantaged people in the U.S., people of lower social financial economic standing, may be less likely to receive proper care, as we know, Lewis, because of the for-profit healthcare system that we've been talking about for years on this show.
Right.
I don't think it's any surprise.
No.
Now, we're already hearing propaganda as a result of this study. So you need to know exactly what you're going to hear, and I think we'll discuss it now, because you may hear some of these propaganda arguments and be convinced that actually it has nothing to do with the U.S. healthcare system, which many will tell you is the best in the world. One idea that's already being floated is, well, countries define birth differently than the U.S. Therefore, we can't really look at this study and determine anything about infant mortality rates. Incorrect. That's complete Republican propaganda talking points. The WHO, the World Health Organization, uses the exact same standard as the U.S. in defining a live birth, period. Anything else is a lie. And Natan's bike isn't even on, but I know he's talking.
So what you're saying is the WHO defines birth the same way as the U.S.?
That's right. And as far as this study is concerned, the same standard for birth is used for all countries involved. Okay, I guess it was just a simple clarification, I guess, from Natan.
Right, so birth may be defined differently in a different country, but the organization that did the study used the same standard for every country.
And they were conscious of that in putting these numbers out. Exactly. Okay. Now, still, the toll of neonatal deaths is much worse in many other countries. In Afghanistan, 1 in 19 babies dies during the first month of life. But is that really our standard? Should the U.S. standard of what is an acceptable amount of neonatal death be based on, well, it's really, really bad in Afghanistan, for example? I don't really think so. And there's a number of issues here we have to consider. What about, but our healthcare system is the best in the world. Issue number one is not for poor people. Not for poor people at all, as we know. And if you don't by now realize that, if you don't by now realize the significant disadvantage that those without money are at in the U.S., and even those with some money, right? We're not talking about just the very poor that are significantly negatively affected by the for-profit, corporate, cronyism healthcare system of the United States. I probably can't convince you in a few minutes on this show, Lewis.
Right.
For pro-lifers, that's another issue, right? We hear about the culture of pro-life. That involves babies before they're born, okay? And as we see, it's just not translating into baby health after they are born. That we know.
Honestly, the Republicans have this whole thing backwards. They want to protect a human being before he's actually born,
right?
But not once he's born.
Of course.
I mean, I think this is pretty clearly the opposite of what we want for the U.S.
It's the opposite of pro-life. It's the opposite of what it's being defined as. And there's a lot of other cultural issues here. People who think vaccines are evil, right? There's nothing like fighting science with non-science. The anti-vaccine movement, in the limited research I've done, and either of you guys correct me if I'm wrong, is not prevalent in any significance in any other country at the U.S.'s level of development, as it is here. This vaccine conspiracy theory that's constant.
Right, as far as I know.
Natan, you know anything about that?
As far as I know, there's no anti-vaccine movement of any significance in Europe.
The other issue here to talk about is the physical condition of the mother going into the pregnancy. And that's going to have a major impact. And with more and more adults, especially young adults without health insurance, without health care at all or very little, pregnancy is often not properly monitored. And I guess it's better to have no health care than socialized health care, right? Because that would be like the communists, and the communists are bad. And anything that the government provides is communism. I mean, I'm trying here, Lewis. I don't know if I'm doing a good job.
Yeah, if we have socialized health care and you need to, your baby's coming out, you may need to wait 4 months in the delivery room before someone comes in and actually
That's
helps
right.
you with the baby.
The baby might be 4 months old before anybody even allows it to be born if the system is socialized.
Right.
Exactly right. And also, we don't really have the time or to be quite honest, the expertise to get into this. But why so many premature births is also a question.
Right, that's a whole nother conversation.
It's a whole other conversation, and there's a lot of factors that could go in there, including we need to look at diet, GMOs, other hormones that are a regular part of many people's diets in the U.S. Big food corporations and agriculture companies like Monsanto do not want anyone to investigate that link. Anyone. And that, of course, ensures the FDA will really probably not consider it either. It's something that should be investigated. We could do a whole show on that.
Right.
But while we're mentioning issues here, it seems that one should be mentioned.